What's a mammogram? It's an X-ray of the breast. It's done by placing the breast on a plate. There is some compression, and an X-ray is taken. It's not a it's a soft tissue X-ray, so it shows up the tissues, and what we're looking for are areas of calcifications. Those would appear as white spots within the breast, and sometimes we also see lumps or other masses. If a lesion is seen on mammogram, especially if it is suspicious, the patient should be referred for secondary care, and this is generally done by a surgeon or a gynecologist who has an interest in the care of this condition. Solid lumps usually require biopsy, and a biopsy may be done in several ways. You can do a needle biopsy, where special needles remove a core of tissue from the breast and submit it to a pathologist for analysis. Sometimes we excise the entire lump, and this has the advantage of getting rid of the problem as well as giving us the information as to the cause of the problem. If the biopsy comes back as positive for breast cancer, there are other things that the pathologist will tell us. They could tell us the level of aggressiveness of the tumor. They could tell us something about the grade. They could also do tests to find out whether there are any receptors on the surface of those cancer cells which would aid in us providing other forms of treatment in addition to surgery. Chemotherapy is a type of poison. The idea behind it is to give a chemical that will poison cancer cells but not normal cells. The problem with chemotherapy is that no drug can identify what is normal and what is not. So how the drug works is that it targets fast-growing tissues, because cancers generally grow at a rate much faster than normal tissues. And by identifying these chemicals that act against them, we have classed them as chemotherapy drugs. One of the things that women often fear is the loss of their hair when they get chemotherapy. The reason for this is hair, nails, the lining of the mouth, the lining of the gut are all fast-growing tissue, and as a result they are also affected by chemotherapy. The way we minimize the amount of damage that is done by the chemotherapy drugs is to divide up the doses into smaller amounts and to give multiple drugs. So the idea is to give multiple small doses of this poison that will target different aspects of cell growth and therefore minimize the overall toxicity. Because the fast-growing normal tissues are going to be affected, this is responsible for much of the side effects of chemotherapy. The good news is that once we've stopped the chemotherapy, these normal tissues will recover. So the hair will grow back just as it was before. The fingernails will grow back. The lining of the gut will repair itself. The idea behind it, of course, is that the cancer does not. Okay. So my take-home message to women is, when you get to age 20, start examining your breast. Do it every month. Do it while you're in the shower. Do it while you're lying on the bed. Know your breast, because they're yours and nobody will know them as well as you will. When you get to the age of 40, start your mammograms. Do it every year. Do it as a birthday present to yourself. When you get to 70, you may stop.